Hello everyone, this is Dr. Durst with Revitalyze MD. So we do lots of different procedures for hair restoration in the office, and one of those procedures is PRP. So PRP is platelet-rich plasma. That's when we draw your blood and spin it down and get the platelets, and platelets have growth factors in them, and we want a concentrated form of those growth factors in platelets so that we can re-inject them into tissue to get rejuvenation. And in the scalp, we're talking about hair rejuvenation or restoration. So what we do, again, you come to the office, we end up drawing your blood, and then we process that blood to get the platelets in a very concentrated form. And then once we get those platelets, we're going to inject them. But in the meantime, we'll put some topical numbing on your scalp wherever we're going to inject. Sometimes we can do some blocks, nerve blocks, to basically numb an area. In particular, we can do that in the forehead to numb the top part of the scalp. We can actually do a ring block around an area that might be thin on the top, or we can actually ring block the entire scalp if we needed to. So there's lots of different ways that we can block and provide comfort during this procedure, because we are injecting the scalp with multiple needles and lots of PRP, which is going to get you better hair growth for sure. Next we do is we prep it, we cleanse the scalp, and then we basically are using a tool that provides us multiple different needles to inject the PRP diffusely so that we get a diffuse spread of that. Occasionally we will do some microneedling on the top of that. And sometimes with the diffuse injections and the device we use, we actually get enough inflammation just from the multiple needles at one time, and we get spread, so we don't need to do that microneedling. Injecting PRP is going to get you hair growth. We have other ways to do it, such as exosomes. We have a laser treatment. We can inject peptides into the scalp. We want to determine and decide with you what procedure is best for you. And sometimes it's a pairing of different procedures so that we're hitting that hair growth with multiple modalities, and including optimizing the cell with, vitamins and supplements that are going to help that. Is PRP right for you? Do you have recession? Do we need to do it a step stronger? With exosomes, do we need to do a laser package with it? So again, lots of things go into it. We even are injecting peptides into the scalp, not only lasering and putting peptides on top of, and those all work together with the injectable PRP or exosome. So to find out what's right for you, I encourage you to call or text our business line and come in and see one of us so we can talk about your hair loss and how we can restore it. Again, we're here to revitalize your look, your health, and your sex life. Thank you.